Good morning, dear students. My name is Muhammad Magid. I am a lecturer of neurology at Shams University. In this video, I'm going to show you how to examine the optic nerve and the ocular examination. Okay, so as all examination, we have to start with greeting the patient and explaining the procedure itself. ازي حضرتك؟ دكتور محمد ماجد مدرس أعصاب. هستأذنك أفحصك. So now on to the optic and the ocular examination. First of all, the optic, we have the visual acuity, the color vision, then the accommodation reflex and the light reflex. Okay, the visual acuity, of course, we have to remember in each step that we're going to examine each eye separately. Okay, so I'm going to ask the patient to cover one of his eyes and then examine the other. استأذنك غطي عينك الشمال كده بإيدك. Okay, so I'm going to test for the visual acuity first. I should stand 6 meters from the patient and then check for his acuity. دول كام؟ Okay. So if the patient cannot see from 6 meters, I'm going to gradually start coming closer until around 50 centimeter, and then I'm going to proceed to hand motion and then perception of light if the patient still cannot see. Okay, and of course I have to do this for the other eye as well. Then we have to examine for the color vision using either red or white colors, and of course each eye separately. عينك اليمين. تمام. ده لون ايه؟ برتقال. تمام. Then the accommodation reflex, I'm going to have him focus on a distant object and then have him focus on a near object and notice for the patient's conversion and miosis. Okay. خليك بص على القلم كده. تمام. ركز معايا. معلش مرة كمان. مركز معايا مرة. Okay. Then the light reflex, I have to remember that we're going to check for the direct reflex, the indirect reflex. Okay, so I'm going to have my hand between his eyes, so no light would be transmitted to the other side. And then خليك انت باصص قدامك. I'm instructing the patient to look directly forward, and then from the lateral side I'm going to shine the torch on his right eye, noticing the constriction in his right as well as his left. Okay, and then from the other side خليك باصص قدامك. I'm going to do the same, noticing the constriction in his left eye as well as his right. And then removing my hand, I'm going to do the swinging movement to look for any relative afferent pupillary defect. Then we're going to examine the ocular motility. We're going to examine each eye separately and then the conjugate eye movement. غمى عينك اليمين. تمام. بص على صباعي وامشي مع بعينك. Okay, I have to remember to fixate the patient's head and instruct him to follow my finger. Okay, ماشي العين التانية. Okay, the same movement, H-shaped. I'm looking for any limitation of eye movement. Okay, خلاص نزلها. Then we're going to examine the conjugate eye movement. هتبص على صباعي وتمشي مع بعينك الاتنين. Okay, horizontally and vertically. This is the pursuit movement. And then the saccadic. بص هنا. تمام. بص هنا. بص فوق. بص تحت. Okay. Again, I'm looking for any limitation of eye movement, any nystagmus, any internuclear ophthalmoplegia. Okay. And in the end, I'm going to comment if there's any ptosis in the patient's eyelids or any proptosis in his eyes. So to conclude our findings regarding the optic and the ocular examination, we have to explain each eye if there is any decrease in visual acuity or abnormalities in color vision. We have to comment on the light reflex, either direct or indirect, and we have to comment on the ocular motility, either single or conjugate eye movement, as well as the presence of any ptosis, proptosis, or nystagmus. Thank you.